In the last week, we've seen a dramatic increase in the number of people becoming infected with the COVID-19 virus. We've seen those numbers rise every day. Since June 27th, which was just 7 days ago, 88 Yellowstone County residents learned that they are among the nearly 1,130 Montanans who have been infected. Those 88 people becoming infected in the last week represent nearly 40% of our total cases in Yellowstone County, which go back to March 13th. As you're aware from the state map, Yellowstone County reported 23 positive cases yesterday. Today, 4 more cases have been reported, and I'm pretty sure that we'll receive more throughout the course of the afternoon and evening. Because of the incubation period of this virus of up to 14 days, we expect that the large daily case counts will continue for the next few weeks. Right now in Yellowstone County, we have 105 active cases, which is the largest number in the state. We also have 7 people hospitalized in our local hospitals, one of whom is in the intensive care unit. When we look at the number of contacts per case, just the cases from yesterday could add between 100 and 200 people in mandatory 14-day quarantine. Those are people who won't be going to work or doing other activities because they've been identified as contacts to a known case. And as I said, we expect the case count to grow, and therefore the number of people in quarantine, mandatory 14-day quarantine, will also increase. The most recent bunch of cases that we received involved a number of different sites, including places of work, large gatherings, and senior care facilities. In the last week, we've seen nearly a dozen COVID-19 positive cases in a number of senior care facilities involving both residents and staff of those facilities. We've been working closely with those impacted facilities on investigation, infection control, and we've recommended that those facilities test all residents and all staff. Further, today I'm issuing a health officer order for Yellowstone County, temporarily restricting visitors to senior and assisted living facilities, including but not limited to skilled nursing facilities, assisted living facilities, memory care facilities, and adult group homes. This health officer order does make an exception for compassion visitation at the end of life. Compassion visitors are also required under this order to wear a mask or face covering at all times while they're in the facility. The health officer order also strongly recommends policies in those facilities that require workers, contractors, vendors, and others to wear a mask or face covering while in the facility. And this order will go into effect at 12:01 a.m. tomorrow, July 4th, and will remain in effect until it is rescinded or modified. The people who reside in these facilities represent some of the highest risk, most vulnerable members of our community, and the intent of this order is to supplement the ongoing efforts that our senior care facilities have taken to protect these residents from COVID-19. All of us must take precautions this holiday weekend to slow the spread of COVID-19. We're at a point where we can get it right or we can get it wrong. As I said earlier, we expect to see more people becoming infected with COVID-19 as Montana reopened, but the steep spike in cases continues to stress the ability of public health agencies to do timely investigations of positive cases, as well as getting test results back quickly enough to limit the virus's spread. I've said it before and I'll say it again. Our best treatment for COVID-19 is prevention. So it's critical that if you have the disease or you're identified as a close contact of someone who has COVID-19, you immediately call back when Riverstone Health contacts you and follow our instructions to isolate if you're ill and quarantine if you're an asymptomatic close contact. Keeping infections low requires us to follow the 3 W's. Wash your hands, watch your physical distance, and wear a mask, especially in situations where physical distance cannot be maintained. Everyone's health and well-being is at stake, especially those who are most vulnerable to illness and severe cases. Failure to follow these simple recommendations, these common sense recommendations, means more sick people, increased demands on the already stressed healthcare, social service, and public health systems, and ultimately more deaths in our community and in our state. This virus is going to be with us for a long time, and we have to learn to live with it. Now, before I take your questions, I want to remind the public that our next free asymptomatic COVID-19 testing. Bear in mind that is asymptomatic. Event that will be on Saturday, July 11th at 9 a.m. to noon in the parking lot at Metro Park. In addition to the July 11th testing event, we are working out the details for ongoing asymptomatic testing opportunities, and we'll have more information for that as that becomes clear. Again, thank you all for coming today. Thank you for doing your part to keep us as safe as we can possibly be. And I'll now take any questions from the media.